Hello, everyone, and join me in congratulating Dr. Raveesh. He's All India Merit List 1 and Common Merit List 1. Quite a stupendous success. Dr. Raveesh, congratulations.
Thank you so much, sir. Thank you for having me.
So it's always a pleasure when Ravish messaged me that he's got rank 1 in both the categories. I told him this is what was expected of him. So he was doing pretty great in the mock test series that we were doing, even the mock interviews, the grand and the elite test series. He was always doing good. So it was something that was very much expected from you, Ravish. So, Ravish, just for the sake of introduction for our audience, can you just share with them where did you do your undergraduation and post graduation from?
Yes, sir. I did my MBBS from Bangalore Medical College, and I did my post graduation MD Medicine in from PGI Chandigarh.
So Dr. Ravish cracked it in first attempt. This was his first go at the exam, and he cracked it quite a great one. And to top and surmount it, I remember he did very well even in the mock interview session, and he's got a perfect score, 20 out of 20 in interviews, and that is again a beautiful performance in terms of interviews as well. Congratulations again, Dr. Ravish, for that as well.
Thank you, sir. Thank you so much.
So Dr. Ravish was a full course subscriber, including the test series, the videos of the DocTutorials. So, Dr. Ravish, let me start. When did you choose to decide that you're going to appear for cardiology and your target is INI? And how was your preparation in your residency, especially MD medicine? And what was your preparation strategy? Did you focus specifically in cardiology, or were you strengthening your medicine as well as cardiology? Did you get oriented accordingly? And when did you start subscribing and preparing for cardiology dedicatedly? Those are a couple of questions all mixed up together. I think it's all yours.
Yes, sir. So I actually liked cardiology from the very beginning itself, even during my MBBS days. And even during my MD, I liked cardiology, but just wanted to make sure that I'm not taking a very hasty decision. And I just wanted to go through MD medicine first and then come to a final conclusion. So in PGI, we have all the various super specialties were posted there for 1 to 2 months. So I went through all of them, and I had my MD exam around April 2025. And after that, I took a short break, and over the next 2 to 3 months, I decided I wanted cardiology itself, mainly because of the nature of the branch, of the versatility, the diversity of the branch, because cardiology has a lot to offer. I feel there's a lot of scope for research, intervention, the clinical cardiology, preventive cardiology. So there is a lot of things which are going on. So that also made me choose cardiology. So finally, I came to a decision at around the end of August, and after coming to the decision, I straight away started preparing. So I dedicated preparation was for 3 to 4 months. During my MD medicine time, I was mostly I was concentrating on medicine part itself. So I used to watch certain videos, and I used to strengthen my concepts, and I used to add some extra points in Harrison as well. However, I was not particularly preparing for any super specialty exam during my MD medicine.
Okay. So when you was looking forward to prepare for cardiology, how much of that reading came from cardiology section of Harrison, and what proportion of that also came from Brunwald or some other dedicated book? And were you also looking forward to once you're done with your preparation, looking forward to the videos and the extra material that you were looking for, like the recent late breaking trials? You were also part of the WhatsApp group, a
Yes,
couple of them actually that we have for the preparation. So
yes.
how was that preparation added up in terms of beyond Harrison kind of a strategy?
Yes, sir. So while studying MD medicine, I was just mainly focused on Harrison. So I feel Harrison is very underrated because there are a lot of things which even come for super specialty exam, even INI, not just NEET,
Correct.
from the Harrison part of cardiology itself. So I had
Yes.
gone through Harrison properly,
Line by
and
line.
after yes, sir, line by line. That is, I think, extremely important because you have 3 years of MD medicine for that. I think definitely there is sufficient time, and it is definitely possible to go through Harrison, at least the important topics. I think after that, once I started preparing properly for the INI exam, I went through all the previous year recall videos.
Yes,
I
this
think
is important.
INI, there is a usually there is a pattern where many of the questions are repeated from the same topics,
True.
and sometimes even direct questions are repeated from the in the cardiology part and even in the medicine part. So I think watching previous year questions is the most important thing which you can do while preparing for the exam. Even if you don't do anything else, at least that is one thing which should be done. And I think along with that, the QRP session is actually very was very helpful. I felt the QRP session in the app, and also there were the last minute sessions on spotters and
Ah,
all
yes.
that, ECGs, angiography, which is available even on YouTube. I think all those resources really
Water
helped.
videos.
And you were
Correct.
always posting the latest trials in the WhatsApp groups also, and even before the interview also you had posted all of them. So I had gone through them properly. I think that also helped me a lot, sir.
Right. So, how do you actually go about preparing a topic per se in cardiology? For example, you would first watch the video in the app, then give its test, or first you would do theory, then the video, then give the test, and then give the test series. What was your methodology of preparation? A lot of people tend to do the other way around, like they will give the test, see what where they're lacking behind, go back and read, and then rewatch the video. So, what's the methodology that you would recommend, or what you followed? I mean, there are two ways to do it. So, what was your strategy?
Sir, I think there are two aspects to this. One is watching the videos and solving the question bank. I think they go hand in hand. You should watch the videos and simultaneously you solve the question banks, because sometimes in the question banks there are some points which are not, which may not be completely explained in the videos. And the question banks are specifically made with the Braunwald in mind. I've seen the DocTutorials question bank. Most of the questions are like direct lines from Braunwald. So I think I did not have the time to read Braunwald actually, because I just had 3 to 4 months. I had studied only the ischemic heart disease portion of Braunwald, and I had just solved the review and assessment MCQs part of ischemic heart disease. But the remaining, I did not have time. So it was just the videos followed by the question bank. And if there are some extra points in the question bank, which are usually from Braunwald, I used to add that to my notes, so that finally I will have a source, common source, where I can properly revise cardiology. And the second aspect to this is giving grant tests. So I think grant tests you should give even if you have not prepared anything. Like even before I started my preparation, I had given a grant test. In that, I had got, I think, 45 or 50 corrects only. So gradually, as I studied cardiology and even the mini test also, I think that should also be given early. So as I studied cardiology, my scores kept on improving. And by the end of the by the last grant test, I could even revise cardiology some at least some 2 to 3 times before giving the grant test. And I think finally the grant test scores also usually reflect in the final exam as well.
That's correct. So I think he's given a very beautiful strategy that you can adopt, and that's what most of the students do. Do the video because you already run with Harrison. Do the video, do the test. There are, as you mentioned, our test modules and even the MCQs are so exhaustive that it includes and goes beyond Harrison, and most of them, as you said, are verbatim from the Brunwald's textbook of cardiology, and that's we have deliberately done so that you don't have to actually scroll each and every page because that's very tough for somebody who's just getting into the post MD and getting appearing for the exam directly. So
Yeah.
that's the good strategy that Dr. Ravish followed. So Dr. Ravish, how did you rate? How did you find the videos for preparation for cardiology for the INI modules?
Sir, I think the videos were very excellent, sir. Again, most of the points are directly from Braunwald. So, for a
Correct.
person who has limited time for preparation, so I think watching the videos is a very good substitute for Braunwald. So, I don't think I could have completed Braunwald in a span of 3 to 4 months, and it is not possible to revise again, the whole thing again. So, I always feel reading once is as good as reading nothing, not reading things at all. So it is revision which helps us actually finally to consolidate our concepts. And I think minimum of at least 2 to 3 revisions is definitely essential before the exam. And watching the videos is and making notes and also studying those notes in a consolidated manner, I think is extremely important, sir.
Right. So, I mean, a lot of times I used to get this feedback from some other students. They would say, "Sir, videos are too high level for an MD. But that's the whole idea, because that's the
Yeah.
kind of questions, that's the kind of competition that we are going through. And most of these students, once they qualify and they'll come back, sir, it's because that you made us prepare for them. Now we realize what it means in residency. I mean, I
Yes.
remember meeting in this cardiology society meeting, a lot of residents, they came over and told me, sir, now we remember what you taught in acute rheumatic fever. It's so exhaustive that when I go through your video in rheumatic fever, there's nothing more that can ever be asked in any exam. So, I mean, I used to get this topic that, sir, why it's so exhaustive in acute rheumatic fever? And I used to tell them this is what is expected, because rheumatic fever is one of the favorites of all the examiners. I mean, they've cut down the vivas to a great extent, but a lot of questions would come here and there. One question from rheumatic fever will come:
Yes.
carditis, major criteria, Jones criteria, murmur, disappearance of sounds, etc., etc. Yeah. So, Dr. Ravish, the WhatsApp group you already mentioned, the test series that you appeared for, how exhaustive and how often would you practice it? How repetitive were they? And I remember you appearing for All India Grand Test,
Yes.
initial test versus the final test. If you can share your experience, how it uh, showed the improvement and how it was your experience about it.
Yes, sir. I think solving grant tests is a very important and integral part of INI preparation. And DocTutorials has they have designed grant tests in such a way that it actually exactly mimics the final exam. So I even found the certain questions which were directly repeated from the DocTutorials GTs in the final exam also. So I think that I was really surprised, and I even smiled when answering those questions, because I knew this exact question had come, because like win ratio, the similar question was there in the final exam also. That was there in the DocTutorials GT. I had not read win ratio till then. Only after the DocT GT I read that. So I think solving GTs is extremely important. I gave GTs every week. So because DocT has a lot of GTs which have been held before also. So every week from August I used to give GTs, and every time I used to learn new things, and I used to find a particular pattern. Like always there used to be a question on contraindications of exercise stress testing. So I felt like this is a very small table which we have to by heart, and definitely always there will be one question. Even in final exam there was one question. So I think you'll see patterns when you solve GTs more and more, and
True.
the same patterns will get repeated in the final exam itself. So if you just go through, revise all your GTs and also revise the previous year questions, I think you may even find exact repeats in the final exam as well. And the
Fantastic.
All India GTs also, sir, I think they were extremely good. And there were a good number of candidates who were giving the GTs as well. So it actually reflected the nature of the competition. So every time I used to give GTs, I used to think there is still a lot of scope for improvement, because the competition is so much. Even if you score 68 correct, 69 correct, still it did not, it was not enough.
I get it.
So
Yeah.
that actually will push us more even to study more and more. So it actually
True.
gives us the idea about the type of competition which is there.
Competition. True. Yeah. So, fine. Finally, when you appeared for the mock interviews I conducted, I remember you volunteering and presenting.
Yes.
Um, how the mocks helped you? I remember you were the one who shared maximum questions after your real interviews back to me. 11 of them. I mean, you were the guy who was asked maximum questions, or maybe recollected most of them. Other guys were sharing five, seven, eight. You were asked 11 questions, and you must have got all 11 correct with 20 out of 20.
Yes.
So, how did the mocks help you, and what was your strategy when you followed up the real interviews, learning from the mocks?
Sir, I think there was a very huge gap between the theory exam and the actual interview. So I actually got lost in between because I did not know how to prepare. After the theory exam, I did not go through any recalls also, because I was afraid if I knew I got many things wrong, I'd be not be very confident for the interview. So I just took a few days break, and then I went through first the previous year mock interviews which you had done in the previous 3 years. I think they were extremely good, sir, because like there were many concepts which I did not know, and I think they covered most of the questions which were even asked in the final interview. Also,
Yes.
I think all of them are like very well curated set of questions they have. So I think that also helped me. So I even made notes of the previous year mock interview sessions
Mocks.
which you had. Yeah, that was a very exhaustive list, and that very
Exhaustive. Three
thoroughly
three
curated.
hours. 3 hours
Yes,
of
sir. Very
mock. Yeah.
thoroughly curated set of questions, I would like to say. And after that, after watching all those, I knew that I also have to give this mock interview because I think this was very important for me. So the when I after I gave the mock interview, actually I gained a lot of confidence because actually I did not know like how I will be able to perform in the interview because I was very nervous. I thought I will get stuck in between, I'll freeze in between. So after giving the mock interview, I felt that I can do it. It is possible, and my brain will not freeze. Like I got that confidence.
No,
And
fantastic,
on
Dr. Ravish.
during
I
the
think.
day of the mock interview, also, I think they were asking very simple questions, sir. Actually, they were extremely clinically oriented questions. They only
Yes.
asked me, patient comes with 3 months on and off history of angina, like how will you approach? Patient comes with normal ECG with troponin elevation with chest pain, how will you approach? Patient comes with young boy comes with history of syncope and QTC is 500, how will you approach? So they were asking all clinical questions, and it was not just a yes or no question or a fact based question. So we have to tell everything from the beginning, starting from the age, history,
History,
examination, then
age.
the relevant investigation. So they expect a particular approach, like how your brain works while seeing the patient in OPD. So I think that is more important than just factual learning. And once you have crossed that question, then they will ask sub questions based on trials and based on the latest things which are upcoming, and then they will just end it with one or two easy questions on biostatistics.
Correct. So I think that's what I prepared when we were discussing this in your mocks as well. That probably you'll end with one biostat question, start with
Yeah,
one clinical case scenario, and that's how usually it goes.
yeah.
So I mean that's the pattern that's been there. So fantastic, Dr. Ravi. So how, in short, how would you recommend myself as a uh, teacher, and then how much do you rate the uh, doctortorials itself? 10 on a scale of 10, let's put it that way.
Sir, I am not such a great person to rate you, sir. Like that will be like very embarrassing for me. So I can just say that like you are a very like a great teacher. Like I learned a lot of things from you, and the passion with which you teach actually. Like you conducted the mock interviews late till 12 a.m. also. So I was very surprised. Like I was not expecting. I thought maybe it was 11 o'clock session. Like it will conclude very early. So you gave chance to so many people to attend the mock interview, and I think you are extremely dedicated. I think the whole DocTutorials team is extremely dedicated, because even in the WhatsApp group, everyone is active, everyone is discussing. So the nature of the academic discussion which goes on in the group is also very good. So all of us are helping each other out. So I think that is a very good conducive atmosphere to learn also. And like I feel DocTutorials just they hold our hands and they guide us. Like I actually highly, I would like to highly recommend DocTutorials also, and definitely I will rate 10 out of 10, sir. Like, I have no doubts.
Thank you, Dr. Ravish. So it's a party time. You must be with family celebrating your success. I would
Yes.
not take much time away from your family. Best wishes to you, and
Thank you so much.
I
Thank you.
look forward to continue mentoring distantly. And you can always reach out to me, as I always say, anytime in
Thank you.
whatever way I can be of help and support to you. I will be more than happy to you. Your closing words for aspirants for the next exams. What are they?
Sir, I feel one is your preparation, and the second is the support system. Like preparation, I think 3 to 4 months of preparation for INI is definitely possible. It is definitely possible. And even if you've not read Brownwald, it is still possible. You just have to follow the videos and the QRP if you don't have much time, and then solve GTs very regularly. GTs is the most important part of preparation, and reviewing the GTs also. And revision is the most important strategy again, because like revising at least 2 to 3 times is important, sir, I feel. And the second is the support system. Like I was very lucky to have such great parents, and I had all my friends from PGI who also have secured very good ranks, and we were always discussing the medicine part, and they were providing emotional support also. I think that is also very important, because the journey is there are a lot of highs and lows. So the support system also should be nice, and your dedication also should be nice. Your source also should be nice. So once all these three things come together, I think anyone can achieve a good rank, sir. I feel.
All right, thank you. That was Dr. Ravish, All India Rank 1 and Common Merit List Rank 1 for the INI SS November 25 in DM Cardiology. And looking forward to stay connected with you, and best wishes, Dr. Ravish. Good night.
Thank you
Thank
so
you.
much.
Bye bye.
Thank you. Thank
Thank
you.
you. Bye.